okay? If anything.
Okay.
Okay, thank you.
Sounds good. Hello, everyone. I am Lori. I'm going to start our conversation first. My partner, Dr. Elise, she is here and she'll be taking the second half. So my name is Lori. I am the owner of U Physical Therapy, and I have been a physical therapist for over 23 years. And now I specialize in women's health for a pre and postnatal issues. And those ideally and typically have to do with the pelvic floor. And that's mainly what I want to talk to you guys about today is what exactly is the pelvic floor? I think it's a term that's starting to come out a little bit more and people are hearing about it. And of course, if you are planning for pregnancy, preparing for pregnancy and birth and all of that, it may be a little bit more in your conversations. But even when I work with postnatal moms and they've gone through even having 2-3 babies, they're still not quite sure what makes up the pelvic floor. And so I brought my model today to kind of start here and give you guys a visual. So the pelvic floor is your pelvis, which is these two bones here on the side. And the pelvic floor is all of the musculature that makes up all of the bottom of the pelvis. And so as I'm sitting here in my chair, this is what is facing you. But if I were to lie down, then this would be everything that you would see from the muscular component. And if I flip it around and let you guys look kind of downward and in, you can see all the musculature here on the inside that makes up the pelvic cavity. And so when we are talking about preparing for pregnancy and birth, we want to make sure that these bones are moving in a fashion to support the growth of the baby, as well as same thing on the muscular side. And so these muscles, which are just like any other muscle of the body, they can get tight and become restrictive, or they can also become too loose. And so we need there to be a balance. And in our comfort and alignment workshop that Dr. Elise is going to be talking to you about a little bit later on, we really dive in to the specifics and we give you lots of tips and tools of what you could be doing throughout your pregnancy to prepare your body for the birth of your baby. But for today's conversation, I wanted you to have a really good idea and concept of what it means when we're talking about the pelvic floor. And so when we're talking about pre and postnatal topics, from a prenatal standpoint, what I do as a physical therapist is, yes, if there's back pain, if there's hip pains, that gets looked at from a traditional physical therapy standpoint. But then we also want to be looking at what is this pelvic floor? How is it functioning for you? If you're already going into a pregnancy where the pelvic floor is tight, and those issues can come across as pain with sex or pain with insertion of tampon. If you are an individual who suffers from constipation, long-term constipation, that could also cause a tight pelvic floor. Then we want to, of course, get these muscles soft and ready to give birth. And even if you don't have a tight pelvic floor, we still want these muscles to become soft and supple. So there's breathing exercises that you can do. There's actual manual massages that can be done by yourself or your partner to help prepare you for giving birth. And then when we're talking about postnatal complications or difficulties that I end up seeing, those can be pain with sex after you have baby, because a lot of times what happens is the pelvis, as it goes through opening for the baby to come down and out through the canal, the pelvis can remain in an open birthing position. And when we're in that, when the body still stays in that open birthing position, we end up seeing pain with sex after going through birth. And then also, as I mentioned before, even pain with just any type of insertion, even if it is just say with a tampon. So we want to be able to check the alignment of the pelvis. And then we can end up having urinary incontinence or fecal incontinence issues. And those are the things that we hear, well, when I cough, laugh, sneeze, or jump, then I end up leaking urine. And a lot of times the problem is that these muscles, after the baby comes out and through the vaginal canal, these muscles have been stretched for over 9 months as the baby's growing in weight and getting bigger and bigger and sinking down into the canal. So these muscles then get stretched and they get weak. And so that's where we end up seeing issues with urinary incontinence or fecal incontinence, to where you could be losing some bowel, or just even flatulence, where you're leaving gas out even as you're just trying to, sit up and get out of a chair, because you've lost control of the muscles. And the brain, what happens is, as you've been carrying this baby in your belly for 9-10 months, what happens is not just the pelvic floor starts to get weakened, but also the abdominals. Those also grow and stretch. And so we also look at what's called diastasis recti, where you get a splitting of the abs that kind of leads to that post-mom belly pooch, where you'll hear mom say, I've lost all my baby weight, but I still can't get rid of this belly that I have. And that could be an indicator that you have a splitting of the abdominal wall. And in that splitting, you need to relearn how to turn on your core. And those are the things that I teach postnatally to moms after going through childbirth. Another issue that I also take care of is what are called prolapses. So a prolapse is where an organ from inside your body, and if we look in here into my little model, what can happen is, let me show you this way. So your bladder rests right here, kind of where my finger is, and this is called your urethra, which is your pee hole. Then we go into the uterus, and then we have the rectum here in the back. And what can happen is, again, as these muscles get stretched out, you can end up having one of these three areas start to drop down into the vaginal canal. And when you go for your postpartum checkup with your OB, they always look to see how you're healing around that 6-month mark, and they'll tell you if you're healing and how the tissues and everything look. But they don't really test for diastasis recti, which is that splitting of the abs, and they don't really look at prolapse unless, of course, it's really profound. And when we're talking about any one of these organs dropping down into the vaginal canal, there's different grades. And so grades 1 and 2, the organs are still in your body, but they're just resting lower. So sometimes individuals can feel that difference if they are inserting a tampon, to where they're like, I feel like I'm hitting resistance and I didn't have this before giving birth. So that can be an indicator that the uterus is just hanging down a little bit lower than it needs to be. And then we look at grades 3 and 4, to where the rectum, the bladder, or the uterus is almost resting right outside of the vaginal canal, or are fully outside of the body. And an indicator that other things that people will say is that they feel like they're sitting on a golf ball. So if you notice that you're having some of these issues post-pregnancy, that you're not able to keep in urine with exertion, if you feel like you're sitting on a golf ball, you're having pain with sex afterwards, that is a great opportunity for you to find a pelvic floor physical therapist, so that you can actually be assessed to see what's happening with this musculature. It is not normal, regardless of what a doctor may say. A lot of times I hear that my doctor said they told me not to worry about it because I had a baby and this is normal. And yes, those changes are normal, but they do not have to remain normal. And that's the biggest piece that I would love for all of you to walk away with, is that if you feel that something is off and different inside of you, it is definitely worth getting checked. And if you, when you do go to a pelvic floor physical therapist, we do an internal exam. We feel the left and the right sides of the pelvis, so that as we come inside, our fingers are actually resting on these muscles, so we can feel what the strength of that is. And so we'll get into having you do a Kegel. We assess the Kegel, we assess the strength of the Kegel. We also assess the endurance of the Kegel, just like any other muscle in your body. And so it gives us a full picture of how the left side is comparing to the right. Where is their tightness? Where is their weakness? And then from there, we of course develop a plan for you to heal and get better. So that's the biggest piece that I want everybody to understand, that this is this area of your body should not be taken lightly. We typically don't even think of this area of our body until we are having some kind of issue with it, or pain, or it may be that time, of the month, is that's kind of like when we become more aware of it. But outside of that, we don't talk a lot about this area, even as women. But it's very important because there's many things that can go wrong, but at the same time can be treated and rehabbed and take you right back to feeling normal again. So having said that, I'm going to hand it over to Dr. Elise, and she's going to be talking to you about chiropractic care.
Awesome. Thank you, Lori. So as she said, I'm Dr. Elise Hamilton, co-owner of Hamilton Chiropractic in San Mateo. I am a prenatal and pediatric chiropractor that I only see and specialize in pregnancy, and then postpartum as well, and then also see babies as young as hours old through childhood, and then through the rest of their life. And I really try to kind of spread the word that it's really important to get chiropractic care even before you are thinking about being pregnant, just so that we can have a good baseline, to really have a great pregnancy, and then birth and postpartum, because it really does start even before. So just diving into what's chiropractic and how does that really help during pregnancy. As a chiropractor, we are looking at the nervous system. We're looking at how that's connecting through the brain, through your spinal cord, out through the nerves, and those nerves go to every cell, tissue, and organ in your body. And that's pretty profound. We want to make sure that that communication through the body is top notch, right? We want to make sure that it is running smoothly and it knows what it needs to do. So our body does, in fact, know what it needs to do. It doesn't need really much help. It just needs no interference. And those interferences can come up mostly from stress. And those are lots of different ways of stress, but the most common is like our physical stress. So we're working out a lot, or we're getting injuries, we're commuting to work, maybe not so much now, but in our regular lives, what are we doing? Sitting down a lot, working at a computer, and all of that builds up into that interference for our nervous system. So as we have our pregnant moms, just basics, wanting to make sure that our nervous system is working at full force for you to create life and have that beautiful pregnant experience. So I have this little model here, and it is very basic. I tried to make it a little bit more friendly for you to kind of see how it really is going to be effective for your whole process. So this is my spine model, and this is a pregnant belly, if we can imagine that. So this is right where baby is essentially living and being held. Of course, everyone's going to be holding their pregnant mom or pregnant belly a little bit differently. But let's imagine this is, not full term, but we have our pregnant belly in that pelvis like we were talking about with Lori. This is where baby is being housed and really where all that magic happens. So as we have our nice, this is our nice spine. This is a way that it looks naturally. This is what we want. We want those curves. And as baby grows, right, the balloon gets bigger and it just weighs down on this low back. And it's going to start to pull that low back just a little bit more forward every time it grows bigger and bigger. So we have this low back that's starting to sway in the back. It's starting to be pulled forward by that belly. And that's going to create some instability through that low back. Those muscles are going to have to work harder to hold it together. And then over time, that can kind of wear on that body. So as a chiropractor, I'm just looking for that area, looking for those the spine, specifically where it's moving and where it's not moving, to help balance it and bring it back to a way that can withstand all those changes a little bit better. So as Lori mentioned, I'm also mostly focusing on this pelvis here, we want to make sure that it's moving and it's growing, allowing you to grow that baby as well as it can. And we have sometimes, let me turn this around. So these are, like Lori mentioned, kind of those hip bones, and we have our sacrum here. We have these two spots in between those bones, our SI joints, that are supposed to be movable. They're supposed to be able to, rotate and let things kind of glide and be very smooth. Sometimes with that stress from sitting, from exercising, those can get really locked up, and then they can cause those muscles around it to be more tight. And then we can have a lot of different other challenges that come along with it. Some of those, we have a lot of moms that come and complain of sciatic pain, that piriformis muscle just getting so tight from holding onto that pelvis, making that radiating pain down your leg, or maybe in the front here, underneath belly, where we have our round ligaments. These are my round ligaments here. You can kind of envision. So let me move to the side here. These round ligaments hold this uterus in place and then holds it to that pubic bone down on the bottom. So as the body, or as the uterus stretches and grows with baby, these ligaments are really stretching along with that uterus as it grows. And so as they get tighter and tighter and trying to hold on to that uterus, just to make sure that it, is doing what it needs to do, sometimes we can feel some pain and discomfort in that low belly area right here or on the other side. And that is really common round ligament pain. However, with chiropractic, all of those are being addressed. We're able to, give you tips of what we're feeling, what we assess, and be able to correct those so that you can then continue with your pregnancy without those discomforts. And hopefully you've heard of the Webster technique, which is specific to chiropractic and helps to address the balance of the pelvis, allowing your pelvis to move, like we mentioned before, in the way that it needs to move so that it can house and really help baby grow in the best position possible. And baby knows what it needs to do. It just doesn't need that interference. So I have a little model here of that pelvis. So this is another little pelvis. This one's movable. So this is in the right configuration, right? This is a balanced pelvis. And so like Lori said, this is if we're looking down into your pelvis. So this, if you can see, is going to be where baby comes out of. And this is as much room as it's going to get, right? This is as big, and it's going to be a little bit more actually, because it will expand, right? We have the relaxin hormone that's going to change and allow our pelvis and all of our joints to be able to be a little bit more movable for birth. So going back to, this is the area that baby is going to be birthed out of. And if our pelvis, as it's moving and it's, changing, sometimes, like I said, it gets stuck. So if we change that, and this is going to be, of course, a little bit more than a little dramatic, but for the visual portion of it, if you can see, that area is now a little bit less. There's less room for baby to get out of that area, which then creates a little bit more complications, a little bit harder for baby to be birthed. And so as we can correct and balance that pelvis, we can then allow for baby to have as much room as possible to get through the birth canal. Then if we think about the balloon in that pelvis, right, it's growing out this way, and those round ligaments are attached on that pelvis right here on the sides. And if we're rotating and moving and it gets stuck, it's going to pull on one side more than the other, and that uterus is going to be shifted. Then that then constraints baby a little bit more, and baby's not going to be able to flip and move and get ready for birth as easily as it could if they had a balanced pelvis and it was given as much room as possible. So with that Webster technique, we balance that pelvis to help then allow that uterus to go ahead and relax, those round ligaments to go ahead and relax and just do what they're supposed to, versus trying to hold everything together and really, doing injury prevention. So the Webster technique, like I said, it is specific to chiropractic, but really allows the body to function as it needs to, and is really only used for pregnancy, but I actually use it on all of my patients because we could all use a balanced pelvis. And we don't just look at the structures. That's our main focus, is looking at the spine and the pelvis. But we look at the muscles that attach to the pelvis and the spine. We look at our ligaments, everything that kind of is around that area we look at. And that's another reason that Lori and I work together, is because it's so important for us to be able to talk about the pelvic floor and how important that is, and the structure as well. So that combination is really, really helpful. So for chiropractic, the way that we address or adjust adjust what we find and help with balancing that pelvis and that spine. There's a lot of different ways, and the techniques that I use are very gentle. There's not much twisting and turning like you may have seen or what may be going through your mind. I have moms who get to lay on their bellies for the first time in many months, who are, so excited to, and they are able to be comfortable. I have some pregnancy pillows, and then I use a drop table, an activator, and some manual adjusting as well, which are all very gentle techniques. And then we also talk about how that looks like for baby. So I work with a lot of infants, a lot of babies, a lot of toddlers, and kids. And of course, those are all very different in the way that we adjust. But if we think about how birth is very stressful for mom, birth is also very stressful for baby. And just being born is their first really big stressful event of their life. And we want to make sure that their nervous system is functioning at their best as well. So if we have some subluxations, what we call the areas that aren't moving well in anyone's spine, we see then there's some pain and discomfort that comes along with it. And babies are the exact same. So you can see limited range of motion in the neck because something in here is not moving the way that it needs to be. You can see breastfeeding difficulties where mom or baby doesn't want to nurse on one breast versus the other because they don't want to turn their head. And then that can lead into some more issues where we can have maybe a flat spot developing on that one side where they don't want to turn to the other side. Then we have constipation, upset tummies, or just not able to relieve that gas. So those are just a couple areas that may come up with your infant that could be a sign that you can get them checked out by a chiropractor. And I see there is some questions maybe. I hope that answers some of your questions for that infant baby chiropractic. Yes, so in our workshop that we will be, how is the flat head adjusted? Yeah, so cranial work is very, very gentle. That's how we address the different segments of the cranium. And it looks kind of like we're not even doing anything, but we are, assessing in different ways how that cranium is shaped and what that might mean for what areas need to be addressed, and kind of looking for those spots that aren't moving well. If the baby does have some kind of flat spot that's developing, then we'll look at, of course, the cervical range of motion and see if that's restricted and the cause. But then on top of that, we can do some cranial work as well. So we go over a lot of this stuff in even more detail for our workshop. And we have lots of interactive things as well. So helping you have something to take home with you to be able to work through all of this at home and really prepare for birth. So we go over some foam rolling exercises to help with edema at the later stages of pregnancy, and just what to kind of look for as being an advocate for yourself through birth, and kind of what things that aren't being mentioned that a lot of moms are like, oh, I didn't know this could happen. We want to make sure that you guys are well aware that there are different things that can happen, and then what that looks like for healing. And Lori will go over some other topics about healing and how that really looks for each individual, because it's very different. And then talking about nursing and how that can be really stressful and what kind of complications can come with that, and how both PT and chiropractic can help with those different instances. Lori, would you like to?
Yeah, well, I think this one is for you, Elise. So it says, do we need clearance from our OB during the pregnancy to be able to do adjustments?
No, you do not. Yeah, you can come to a prenatal chiropractor on your own. Most insurances, you don't need any referral either. And then, of course, it doesn't hurt to ask your OB and just let them know, hey, I'm doing this. There are lots of OBs who are supportive of chiropractic, which is great. They think I've had people being sent to me from OBs. So there's a lot that are really supportive and think it's great care to go along with their OB practice. Yeah.
Any other questions out there for us? We have not yet picked a date yet with Blossom for our pelvic floor, creating comfort and alignment for preparation of pregnancy and birth workshop. We still have to discuss that, but that will be, of course, advertised through Blossom once we have that. And as Dr. Elise had mentioned, we really dive more into giving you tips and tools of how to prepare your body as well as your pelvis for the whole entire pregnancy, as well as for birth. And so even if this, I don't know who's on here, and if most of you are already pregnant or getting close to trying to get pregnant, the sooner you can have this information, there's just power in all of that, because you want to be able to, of course, get as much stress out of your body as possible, so that the little one that you're going to be growing, or little ones, as I had in my case, I'm a mom to twins, just has just as much space and relaxation, because they feed off of your energy. So the more that you can be prepared and your body be prepared for all the changes that's going to be happening, you'll just have you'll feel better. And that's really what Dr. Elise and I set out for when teaching our Creating Comfort and Alignment workshop, is just give you tools to help you through all those uncomfortable, moments that are going to come up. So if we don't have any other questions, then I think, Carolyn, we're good.